Hello and welcome. We're in Hamburg at BioEurope 2019, and this is a meeting where the pharmaceutical, biotech and other stakeholders all get together to talk about interesting trends and look for new opportunities to work together. One of the rising trends that we have seen in recent years is talk around the microbiome. We've seen quite a bit of investment around it. I'm joined by Assaf Oron, who's the Chief Business Officer at BiomX.
Right.
You're an Israeli company in that microbiome space. So first, how real is the opportunity around the microbiome?
So, a good sense of the opportunity is the amount of funds being invested in trying to develop these therapies. There aren't any marketed yet, but there is a lot of activity going on and many clinical trials going on. The thought is that we have the same number of bacteria inside our body as the number of cells in our body.
Yeah.
So those bacteria must be interacting with our body. And we know that they are impacting the way we react, the way how we deal with diseases that we have. So the sense is that instead of trying to modify our cells, if we could modify those bacteria, we could impact disease.
Yeah.
And that's what's making it so exciting.
Right. And there's a lot of research actually sort of demonstrating that a lot of this bacteria that we have does actually have an impact beyond the gut.
Right, absolutely. Yeah. So we see evidence of it impacting direct diseases in the gut. Yeah. A good example is inflammatory bowel disease, which is a disease that we know is chronic, is a very difficult disease. There are therapies that just kind of take care of the symptoms, but we don't really know how to block that disease from occurring. That's a good example, but even it goes beyond the gut. So sometimes it goes even to things in our mind, on our skin, other areas of the body that we know the microbiome interacts with.
Right. And the clinical trials you talk about at the moment, where are they focused?
So on some of the key indications in this area, we are now running actually a clinical trial on acne, on skin, and see how we can impact skin microbiome to improve dealing with that disease or curing it. But there are clinical trials today in a lot of diseases that have to do with the gut, like inflammatory bowel disease, C. diff infections, etc. But also you're starting to see other indications, diabetes, and other indications, and we expect to see more and more in the coming years.
So the approach that you guys are developing, could you describe how that works?
Sure, we're using phage therapy. So phage are viruses that kill bacteria. They won't attack our own human cells. They're only targeted bacteria, and they're very specific. And phage have been discovered 100 years ago. So why is all the excitement around it right now? After antibiotics were discovered, people put aside phage because they said, here, we have a neat way to kill bacteria that are causing bad things. But today we understand that there are two big problems. One, there's antibiotic resistance. And the second is that antibiotics are like throwing an atomic bomb in your gut. It kills everything, also the good stuff. And we need a way like a precision therapy, like a guided missile that would really exactly kill the things that are harmful and not harm the things that are good. And a good example is inflammatory bowel disease. We know today that there are bacteria in the gut of people with that disease that are steering the inflammatory response. And now we have a precision tool to eradicate them.
When we're looking at sort of the research you've got, is it identifying the bug in the first place, or is it creating do you create a phage to then attack that bug, or do you find a phage that creates that bug?
So you're absolutely right that first you need to know what the target is. So for that, we license or work together with academia. There's so much research out there. We don't need to find the bugs ourselves. Great researchers are doing that. Some of them are scientific founders. Then what we need to do is plan the therapy. Our therapy is usually a cocktail of a few phage, and we either search for them because they're out in nature. Our body is populated with them, so we find the right ones, and we also have capabilities in synthetic biology. So we can improve them. We can have them target more efficiently specific bugs. We can have them work more potently and widely on different types of bugs. So we can either use natural phage or we can synthetically engineer them to do what we want.
Right. And now you mentioned very, very early on in this conversation about how there is quite a bit of money that has been put to work in this space. Your research comes out of the
Weizmann Institute and MIT.
Yeah. And the funding, where's that coming from?
So we initially were funded privately by strategic investors in the life sci community, such as OrbiMed, but also investors such as Johnson & Johnson and Takeda, which are big players in the inflammatory bowel disease space and see this as potential future therapy. So they're investing strategically in companies like us. We were private for a few years. We raised about $60 million, and actually 2 weeks ago, we completed a public offering and raised another $60 million. So now we're publicly traded.
Okay, and what is the sort of the status of your lead programs?
So our first program is actually in acne because we went to skin because it's really easy to access. It's right on your skin, and we're treating acne with specific phage that know to treat the disease without having antibiotic resistance issues. So that we started a clinical trial a month ago and expect to complete it in 4 months. And the next thing will be inflammatory bowel disease. We expect to enter clinical trials next year in 2020.
Right, okay, great. Well, thanks very much, Assaf, for
Thank you.
Right. Cheers. If you found this video useful, subscribe to the channel and get the opportunity to see other content that we've got coming that will look at industry trends and discussions with thought leaders.